I'm delighted to be here. Thank you to the sponsoring and convening organizations for giving us this chance to engage in this, I think, very exciting national dialogue regarding the reauthorization of the Older Americans Act. I think that we are at one of those special moments in history where we can have a tremendous impact in how we look at this piece of legislation and how it will meet our needs in the coming decades. I want to tell you a little bit about Los Angeles. Most of you are familiar with probably the basic speech, but the city of Los Angeles is ranked second in the number of older persons in the United States. We have over 500,000 older persons over the age of 60 that live in our city. I heard Jonathan speak of the issues of diversity and how in 2050 the senior population would achieve about over a 40% rate of diversity. Well, let me tell you, the future is here, because Los Angeles is about 48% diverse. It's different than the rest of California. So we are a living lab of what needs to be happening in the community and in the nation in terms of looking at models and best practices. We also have a unique challenge. Los Angeles has 2 area agencies on aging designated within the same county region. For many years, I think that was a negative issue, but I think that we've turned it around over the last few years in making it a positive factor for our community. We really are seeing that we have regional challenges that have to be addressed as a team. The city and county have to work together if we are to address the burgeoning growth of our population. Because we represent 1/3 of all California seniors over the age of 60. They live here, folks. They don't live somewhere else. So these are our issues, our concerns, and I think that California could really be a trendsetter in terms of educating the national dialogue about the types of programs and policy directions that we would like to see embedded in the Older Americans Act. We also have some of the largest supportive social health care systems in the nation that exists in this community. And we have very little experience in working collaboratively with them. As systems, because they're so huge that I think we all become very overwhelmed trying to figure out how to engage with public health, how to engage with mental health. We have to start doing that more purposefully. I think that we're going to have many opportunities with Affordable Care Act that will be provided to us to begin to establish a dialogue with our partners in health and other health-related services. The Older Americans Act, I think, is a very, very unique piece of legislation. Looking at it as a person of color and a gerontologist, it's a very inclusive legislation. It targets the most in need, the most underserved. So the language is there. One of the concerns that I have had over the last 25 years working in the Aging Network has to do with where are we discussing the issues of capacity building of that network. Yes, we are talking of the unique needs of older people and how they have to be addressed. But who provides for those services and how do we support them? My experience tends to be it's at the lowest common denominator where we tell the staff person, you have to be responsible for creating the best practice. And hopefully it will work, and they do it in isolation. And if it doesn't work, we get upset with them. And so I want to change that paradigm and say, you know what? The Older Americans Act has this great inclusive language, and now it has to have equally great language to talk about capacity building of a network. We have a growth in the population, yet we do not have the available staff resources to manage. I heard the colleagues speak about the lack of staff available. I also have to think about what happens if we have the money and we can't hire people, because I've been in that situation many times before. And that's, I think, an equally important challenge to look at this opportunity of the authorization to include some capacity building language that would bring resources to the local level so we can begin to look at how will we retrain and retool our staff to meet the needs of the changing demographics of our population and just the large size of the population that we have to serve will require that people think very differently, and that has to be part of training. We're also being challenged that we have to be more accountable for the social services that we deliver and their impact on the lives of older people. So the whole arena of measurement and outcomes and performance is something that we have to really make sure that the Act reflects with purpose. What is it that we will hold value, and how will we be ensuring that the Act holds us as a network accountable to that? I have a couple of recommendations that I would like to forward. I want us to start looking. We've been working with evidence-based models now for about 7 years at the city, and we find that we have seen, with partnership with Oasis Institute, we actually developed a model where we replaced senior volunteers that were trained for trained staff, and we actually got better outcomes. Dr. Wilbur evaluated our process and was actually, her quote was, "This is astonishing that it could be realized that way." So I think that we have to start looking at the opportunities of the aging population and saying, where are the skills that we need and how can we utilize some of these folks that want to come back to work maybe on a part-time basis to create these new offerings in that community, because we would get, I think, better results. I'm also looking, how do we make sure, in California, we're losing the aging network folks. Our programs and our funding is going away, and so we need to make sure that the aging network is there for the authorization when it occurs and for the future of this population. So there's a lot of work locally that we need to be doing, but I think that the Act also needs to talk about organizational need at the local level to AAAs as the conveners of the community. I think that that's what we're learning locally, that we need to be in lead to convene the greater provider networks, the advocacy networks, in order to create the, ensure that the voice of seniors is heard. We're also needing to look at the existing systems, and there has to be support in the Act because this requires staff support. How do we look at the existing systems that provide services in the community and begin to look at them in a different way? I've started to look at the opportunities that other systems bring to the table in trying to create an Aging and Disability Resource Center. I'll give you an example. Rather than going after the grant from the federal government, we actually decided that we were going to build one that would suit the needs of Los Angeles, rather than meeting one that would suit the needs of the federal government. And so in doing that, one of the things we discovered was that the resources were never going to be enough to meet the demands of our community. So our partners and how we looked at partners had to be very, very different. And so as a result, now we're partnering with public health, we're partnering with Social Security Administration, the public libraries. We're now in a partnership that's historic, 156 libraries working with the 2 AAAs as points of access in the community for information, which is what libraries do. And so begin to look, I think, at our environment and saying, where are the resources that the Aging Network has not tapped? And I think that that is part of the leadership that the Older Americans Act needs to bring to the local levels through the Aging Network. I think that this reauthorization discussion presents great opportunities. I look forward to the continuing dialogue with all of you at the local level. And I think that Los Angeles has a great opportunity to lead some major changes in the language that we will have to address over the next decade. So I look forward to working with all of you.